The inside of the body is divided into different body cavities. Overall, we have a dorsal body cavity and we have a ventral body cavity. The dorsal body cavity has to do with cavities on the posterior or dorsal side of the body. The dorsal body cavity is made up of the cranial cavity, which is where the brain is located, and the vertebral cavity, which is where the spinal cord and vertebrae are located. The ventral body cavity is further divided into two bigger regions. There's the thoracic cavity, which is the area in purple, and the abdominopelvic cavity, which are the areas in pink and green. One key structure to note is the diaphragm. The diaphragm is a muscle that is primarily used in breathing, and it also serves as a physical divider between the thoracic cavity and the abdominal cavity. On this picture, you can see it here from the side view and here from the front view. The thoracic cavity is further divided into even smaller cavities. There are the pleural cavities, which are the ones in purple. These are where the lungs are located. There's the pericardial cavity, which is where the heart is located. And then the mediastinum is just the area kind of in the middle of the thoracic cavity here. The abdominopelvic cavity is further divided into the abdominal cavity, which is the cavity here in pink, and the pelvic cavity in green. The abdominal cavity primarily houses the digestive organs such as the stomach, the liver, and the intestines. And the pelvic cavity primarily includes the urinary system structures and the reproductive structures. Clinically, medical professionals can divide the body into quadrants that help with diagnosis. So imagine that there's skin covering this person here, and so you can't see the internal organs. But if you've ever been to the doctor for a physical exam, you've probably noticed that they've had you lay down and they push on your stomach in different areas. And when they do that, they're looking for whether there are different areas that are painful or lumpy. And by having this kind of imaginary plus sign going over the abdominal area, it helps the medical professional figure out what organs are deep to the skin in that area. So, for example, lower right quadrant pain is often a sign of appendicitis, and the appendix is right here. Upper right quadrant pain could have to do with the gallbladder or the liver. And left upper quadrant pain might include the stomach or part of the large intestine. And lower left quadrant pain may have to do with this part. This is the sigmoid colon of the large intestine and parts of the small intestines.